Welcome to this explainer. Today, we're going to look at the human nervous system through a slightly different lens. I want you to imagine it not just as, squishy biology, but as a highly organized, heavily regulated mechanical transit system. Right this very second, billions of messages are commuting across your body, using tiny chemical handoffs to cross from one nerve to another. But what happens when that transit system gets hijacked?
Consider this for a second. How does a single injection of Botox magically erase wrinkles? Or, on the flip side, how can a bite from a black widow spider cause total, overwhelming muscle spasms? It sounds like magic, or maybe a nightmare, but these extreme reactions actually all come down to those tiny chemical handoffs. By the end of this explainer, you're going to understand exactly how these substances, and a whole lot of others, manipulate our internal transit system.
So here's our game plan. First, we'll cover how normal chemical transmission works, and then pinpoint exactly where drugs intervene. From there, we'll examine two specific transit networks, the cholinergic system and the adrenergic system, before wrapping the whole thing up with CNS drugs at the master control board.
All right, diving into Section 1, how chemical transmission works. Before we can understand the hijackers, we need to understand a normal, everyday commute for a neural signal. And that journey begins with the spark of life itself, an action potential. This electrical charge travels down the nerve's axon, changing the membrane potential and triggering voltage-gated sodium channels to pop open. Positive sodium ions rush in, depolarizing the cell. You can think of this as the starting pistol for our transit system, basically propelling that positive charge all the way to the end of the nerve, which is known as the axon terminal.
Once that electrical signal hits the terminal, the commute actually switches from electrical to chemical, and it does this in 4 distinct steps. First up, our chemical messenger, the neurotransmitter, is synthesized and stored in these little bubbles called vesicles. Step 2, the arriving action potential opens voltage-dependent calcium channels. Calcium rushes in, and that acts as the absolute crucial trigger. Third, this calcium influx forces the vesicles to dump their transmitters into the gap, or the synaptic cleft, so they can bind to receptors on the receiving cell. And finally, step 4 is inactivation. The signal has to be turned off eventually, right? So the neurotransmitter is either broken down by enzymes or physically vacuumed back up into the first cell to be recycled.
Moving right along to Section 2, where drugs target synapses.
So let's see how this normal process creates the exact checkpoints where pharmacology steps in. This is where pharmacology essentially becomes molecular hacking. Drugs can target pretty much any of the steps we just outlined. Take local anesthetics like lidocaine. They work right at the beginning of the process by physically blocking those voltage-gated sodium channels. Literally, no sodium means no action potential, which means pain signals never even begin their commute to the brain. Then you have these incredibly potent analgesics like ziconotide. This drug is actually a synthetic form of venom from a marine cone snail, which is wild. And it's 100 to 1,000 times more potent than morphine. It works by blocking the calcium channels at the end of the nerve. So even if the electrical signal arrives, the calcium can't get in, so the pain transmitters are never released at all.
All right, Section 3, cholinergic system, muscles, and memory. Now that we know the basic mechanisms, let's look at the first of our specific chemical transit lines. To make sense of our body's wiring, you really have to grasp the fundamental difference between our two main neurotransmitter networks. On one side, we have the cholinergic system. This system runs on acetylcholine. It's heavily involved in your neuromuscular junctions, so muscle movement, as well as your rest and digest parasympathetic functions, and memory in the central nervous system. On the completely opposite side, the adrenergic system runs on noradrenaline and adrenaline. This is your high-octane survival network, driving your fight-or-flight responses, like rapidly increasing your heart rate. Now, circling back to that opening hook about Botox and spider bites, they actually both hijack the cholinergic system, but they do it in completely opposite ways. The Clostridium botulinum bacteria produces a highly dangerous toxin. In tiny, localized clinical doses, we call it Botox. It enters the nerve terminals and literally cleaves the proteins needed for exocytosis, completely preventing the release of acetylcholine. No transmitter means no muscle contraction. The muscle is paralyzed, and boom, wrinkles relax. On the flip side, latrotoxin, which is the venom of a black widow spider, causes a massive, uncontrolled release of acetylcholine all at once, leading to severe, rigid muscle spasms. Same transit system, entirely different hacks.
But hijacking this system isn't always about toxins. Sometimes it's about giving the brain a much-needed boost. Remember step 4 of our transit cycle? Inactivation? Well, in the cholinergic system, acetylcholine is rapidly broken down by an enzyme called acetylcholinesterase, or ACE.
Drugs like donepezil, sold as Aricept, and rivastigmine, sold as Exelon, deliberately inhibit this cleanup enzyme. By stopping the cleanup crew, they leave way more acetylcholine floating around in the synaptic cleft. Because acetylcholine is absolutely vital for memory, these ACE inhibitors are used to provide benefits in cognition and behavior for patients dealing with Alzheimer's disease and dementia.
But the duration of that enzyme inhibition, that is literally a matter of life and death. Medium-acting acetylcholinesterase inhibitors, like neostigmine, are incredibly useful for reversing neuromuscular blocks after surgery. It's essentially waking your muscles back up. But irreversible inhibitors, like organophosphorus insecticides or sarin gas, actually destroy the breakdown enzyme entirely. Acetylcholine just floods the system unabated, causing continuous muscle contraction, paralysis, and ultimately death by asphyxiation. It's terrifyingly effective.
Moving into Section 4, Adrenergic System, Fight or Flight. Let's shift gears here from resting and moving to surviving. The adrenaline and noradrenaline transmitters in this system don't just do one blanket thing. It depends entirely on which receptor they happen to bind to. Alpha-1 receptors cause smooth muscles to contract, like constricting your blood vessels. Beta-1 receptors increase your heart rate. Beta-2 receptors, however, cause smooth muscle relaxation, like opening up your airways so you can breathe easier. And beta-3 receptors are involved in lipolysis, or breaking down fat. It's brilliant when you think about it. One chemical messenger, but totally different physiological effects based solely on the docking station.
So how do drugs manipulate this high-octane system? Well, take amphetamines, like Adderall. These are indirect sympathomimetics. Instead of mimicking adrenaline directly, they actually bind to and reverse the action of the monoamine uptake transporters. Normally, these act like little vacuums to suck noradrenaline back into the nerve and clear the synapse. Amphetamines literally put the vacuum in reverse, dumping massive amounts of noradrenaline from the nerve directly into the synaptic cleft, which intensely amplifies the signal.
And sometimes this hijacking can happen completely by accident, with fascinating, if pretty dangerous results. Have you ever heard of the cheese effect? Tyramine is a dietary compound found in aged meats, chocolate, and, you guessed it, cheese. It can actually enter nerve terminals and displace noradrenaline into the synapse. Normally, an enzyme in our gut called MAO inactivates tyramine, no problem. But if a patient is taking an MAO inhibitor drug for depression, that cleanup enzyme is disabled. Eating a block of cheese suddenly causes a massive flood of noradrenaline, leading to severe, dangerous spikes in blood pressure, just from a snack.
Other drugs work by surgically targeting the off switch, or specific receptors. Cocaine, for instance, blocks the reuptake vacuums entirely. The noradrenaline just sits there in the cleft, constantly firing the receptors and potentiating adrenergic transmission. On the therapeutic side of things, we have salbutamol, which is the active ingredient in a lot of asthma inhalers. Remember our receptor breakdown from earlier? Salbutamol is highly selective. It specifically activates just the beta-2 receptors in the lungs, causing smooth muscle relaxation and opening the airways, all without drastically skyrocketing the heart rate via beta-1.
And finally, Section 5, Central Nervous System Drugs.
Let's kind of zoom out here and look at where all these mechanics culminate. The synapses in the central nervous system. It's honestly staggering to realize the deeply profound neurological conditions and altered states of consciousness are driven by these exact same mechanical rules we've been talking about. Parkinson's disease is treated with levodopa, which is simply a precursor that the body uses to synthesize more dopamine. Ketamine acts as an antagonist blocking NMDA receptors. Recreational drugs like MDMA or ecstasy work by inhibiting the reuptake of serotonin, noradrenaline, and dopamine all at once. Anti-anxiety meds like benzodiazepines work by increasing the activity of GABA, which is basically the brain's main inhibitory transmitter. Even typical antipsychotic medications like haloperidol work by acting as antagonists that block specific dopamine receptors. It's all just tweaking the transit lines.
So the absolutely crucial takeaway is this. From the sudden gasp of air treated by an asthma inhaler, to the smoothing of a wrinkle, to our memory, our mood, and our very perception of reality, it all relies on billions of tiny, perfectly timed chemical handoffs. When we use pharmacology, we are really just learning the codes to hack this cellular transit system. And honestly, it leaves you wondering, if everything we feel and experience comes down to this, how much of what we consider us is simply a perfectly balanced chemical equation? Thank you so much for joining me on this explainer. I really hope this changes how you view the incredible invisible machinery working inside you every single second.